Yeah, hi. So this study was done out of Oregon Health and Science University in the Brenden-Colson Center for Pancreatic Care, and it's about pancreatic adenocarcinoma. And this is a disease with a very poor outcome. The 5-year survival rate is somewhere around 10%, I think, and the median survival is somewhere around a year. So it's one of the poorest outcomes predicted for any of the major types of cancer. We investigated in this study just two patients, and one of them had a very classic case of disease progression in pancreatic cancer. She was eligible for surgical resection, but despite that, as is true for most patients, she had a recurrence about a year later, and then despite some really intelligent treatment plan, she progressed and died. And so her course was very similar to most patients with pancreatic adenocarcinoma. But the curious thing is that her aunt, who was actually diagnosed with the same pancreatic adenocarcinoma, had some very similar things about the disease course, obviously similar genetics to her second-degree relative, her niece. And she was treated in some ways the same. She was also eligible for a surgical resection and had a recurrence in the same way. Yet she is alive about 4 years later and doing really well. And so the question we wanted to ask is, why is it that these two patients who are obviously genetically related had ended up having very different disease courses? And so, in particular, we're interested in the aunt in this case, the patient who did very well, and why that happened. And so we found several features that were unique to her case relative to her niece that could explain that. And one of them, the primary one, is just that the course of her disease was she developed lung metastases. And, in most cases, developing metastatic disease is going to be portend a really poor outcome. But in this case, and in cases with a lot of patients who have lung metastases, the outcome is actually better for